My name is Sarah Heineman, and I work at Missoula Public Health. I currently am the Director of Health Services. Not necessarily. It depends on if you came into contact with the infected person or if you happen to travel through the same location within 2 hours of that infected person. So if, say, they were in Walmart and you went to Walmart within the same 2 hours that they were visiting that location. And public health would work to determine if there was public exposures and then would do a public notification, such as putting it on our website so that you would know if you were potentially exposed during that time frame. First, you want to determine your immune status and determine if you've been vaccinated or have laboratory evidence of the disease. If not, you might be eligible for post-exposure prophylaxis, depending on the timeline of your exposure and your health history. And if you're unvaccinated and you're unable to receive post-exposure prophylaxis, you're going to be asked to quarantine for 21 days from that time of exposure. We want you to stay home. We want you to practice respiratory hygiene, so cover your mouth, wash your hands, disinfect frequently touched surfaces, and this helps reduce the spread of measles to other people within your household. You want to make sure that you're in contact with your medical provider on how to manage your symptoms at home and when to seek medical care and how to seek medical care. We don't want you to just show up at the doctor's office unannounced. Generally, you're considered no longer contagious after 4 days from when the rash starts. Then, after that point in time, you should be able to go about your business as long as you feel well enough. It would be contact with a known measles case or transiting through the same space that infected person was in within the 2 hours of them being in that space. The first thing you would want to do is contact your healthcare provider and local public health. If you're unvaccinated or never have had measles, you might be eligible to receive post-exposure prophylaxis, depending on the timing of your exposure, the age, and medical history. If it's been within 72 hours of exposure, you might be able to get post-exposure vaccine. And if it's within 6 days of exposure and you can't, for some reason, get the vaccine because you're immunocompromised or pregnant, you could be eligible for immunoglobulin, which is called IG. You might still be asked to quarantine for 21 days and monitor for symptoms depending on your scenario. The best thing you could do is still contact your healthcare provider and let them know, but then monitoring for symptoms. And then if you become symptomatic, you're going to isolate yourself from others, alert your medical provider to establish a safe plan for getting tested and follow-up evaluation. But measles MMR vaccine is a very effective vaccine, so it's unlikely that you would develop the illness. Public health and the schools would likely be collaborating on messaging to alert parents, and then public health might enlist the help of schools to assist with identifying cases and doing the contact tracing. So some messaging would certainly go out to the community and to parents. Immunoglobulin is also called IG, and it's a type of blood product that's used for short-term protection from that exposure to measles. And this is a great option for unvaccinated individuals who are within the exposure window of about 6 days or less. These are for people who can't otherwise receive the MMR vaccine as post-exposure prophylaxis. And it's really the only option for post-exposure for pregnant people and immunocompromised people. And then depending on age and medical history, the immunoglobulin is given either intravenously through IV or intramuscular, like into your muscles. And it's important that we coordinate with local public health because they can help arrange for those PEP post-exposure prophylaxis treatments with one of the local emergency rooms because not everybody carries immunoglobulin.